On this morning's Health Watch, prescription drug shortages. The Food and Drug Administration says hospitals are running out of many drugs, including popular cancer-fighting medications such as Doxil and other chemotherapy treatments. That has created a huge gray market where some medications are marked up more than 600%. Here with more is Early Show medical correspondent Dr. Jennifer Ashton. Dr. Ashton, great to have you with us, Jen.
Rebecca.
You know, this is already a problem.
Right.
We know medication prices are already expensive, even in the best of times.
That's right.
What's driving the shortage?
Well, this is a major crisis, Rebecca. In fact, it's on the front page of the New York Times today, and we will be hearing more about it. Usually when you talk about shortages, it's either one of two things or both, supply or demand. In this case, it really seems to be an issue with supply. The majority of these drug shortages really arise from one of a couple of possible reasons. One of them is low capacity with the manufacturing process. A lot of these drugs are made in companies or factories that just don't have the capacity to make more. A large percentage of these problems come when the inspectors, either the companies or the governments inspecting the production process, finds contamination in these medications. They are more complicated to make. A lot of them come from ingredients that we have to import from other countries, and contamination is a problem. And then lastly, some of them are generic, very low profit margin, and as you speak of all the time, there is no financial incentive for some of these companies to keep manufacturing these drugs because, in fact, now they are so inexpensive.
Which is really troubling considering how much people rely on these drugs.
Correct.
What do you say in terms of tips that people can rely on here if their drug isn't available at their hospital?
Well, first of all, you mentioned in the introduction, we're talking here about a lot of types of medications, anything from chemotherapy to drugs we use in the intensive care unit for critically ill patients, in some cases steroids, antibiotics. I mean, we're not talking for the most part about drugs that you would fill in your pharmacy. We're talking about drugs used in hospital settings for the sickest patients.
That are either going to save a life or not.
That's correct. So a couple of things that patients may be able to do, especially if they're in an elective situation. Number one, call ahead to your doctor or your hospital and find out if the drug that you're supposed to get or the sequence of drugs is in fact available. Secondly, you always want to ask your doctor if there are options or alternatives. Sometimes there are, sometimes there are not. And lastly, if you're going in for an elective treatment and there is a supply problem, ask if you have some latitude about whether that treatment can be rescheduled. Again, in some emergency settings, ICU settings, there are no options. But if you're talking about an elective therapy, oftentimes that treatment can be rescheduled. It might not be ideal, but it's a possibility.
Sometimes the sad truth here is money talks. And we're hearing about this gray market, the 600% inflated prices. Doesn't sound legal, but can it save a life? I mean, if you could gather the money, could you find the drug you need?
Well, we try to discourage people from doing that because, again, you don't know if the medication is counterfeit. You don't know if it's contaminated or been handled or stored improperly. In large measure, those type of gray market dealings are probably legal. They're also probably sleazy, and they may be dangerous. So again, as long as the person selling the medication to this middleman can attest to the fact that those drugs have been purchased properly, it is legal. We're probably going to be seeing more and more of this. This is an emerging crisis. Big problem. As you said, the FDA and Congress are looking at it.
And we're so glad to have you here with us, Dr. Jennifer Ashton, to help people through it, because obviously it's something on everyone's mind right now.
Doctors, patients, hospitals alike.
Thank you. We appreciate it.